I'm Gretchen Overstreet, and I'm a retired real estate person trying to live my best life. I have had a bilateral sacroiliac joint fusion, and it's been a godsend. I was actually leaning over in a box, believe it or not, trying to just pull a piece of paper, and went to stand up, and it just totally took my breath away from me, whatever this catch or this pop, whatever this was. I've had a fusion before, but it was, L4, L5, S1 kind of thing. And so I just immediately thought that was part of it, just I did something wrong, and that was it. The pain just kept getting worse and worse, and I started ending up in bed more and more often because I couldn't move around. It keeps you from doing anything. Go ahead, try to roll over in bed and not scream. You cannot even stir a pot. It was super depressing. I was missing out on my husband, even though he's in the next room, my family. This Thanksgiving, I realized I hadn't seen my niece in over a year. And when she said, "Aunt Gretchen, I've really missed you," it just rips your heart out, knowing that you've missed so many family things because you can't do it. I started off, with one doctor and then another doctor, and I could never really get any answers to the questions. And everybody wanted to say, "Oh, well, I think, it's your fusion, your prior fusion, or it's this, or, you just have arthritis," or something like that. The entire time until I got to Dr. Barkoh, I've been dismissed.
My name is Kaku Barkoh. I'm an orthopedic spine surgeon practicing in Houston, Texas. We're talking all about the SI joint today. Low back pain is extremely common. 15 to 30% of those patients with low back pain, the pain's actually coming from their sacroiliac joint. Your lumbar spine comes down, it meets your sacrum, and your sacrum joins to another part of your pelvis called the ilium. And those two together, where they meet, is the sacroiliac or SI joint. It's one of the largest joints in your body. It's a really robust joint. There's a lot of soft tissue around it, a lot of really thick ligaments that hold it still. For the longest time, people ignored it because it was such a large joint, but such a stable joint with these ligaments. We thought, doesn't move very much, not very important, but that's not the truth. What really got me interested in learning more about the SI joint was that I had a number of patients who had a previous lumbar fusion but continue to have pain. Radiographically, things looked perfect, the hardware was in the right place, but they continue to hurt. And so I wanted to find a solution for those patients, and that's when I stumbled across the SI joint. But there's a lot of strain and force that can go across that joint. That could lead to wear and tear over time. And so degenerative changes, just like you could have arthritis in your knee that can cause pain, you can get arthritis in your SI joint that can cause pain. When I see patients in clinic, I often suspect the SI joint when they report low back or buttock pain. That pain can also radiate to the groin or to their posterior thigh. Often in their history, they'll mention things like pain with transitions from sitting in a chair to standing. They might have difficulty going up and down stairs. A lot of times it's alleviated by rest. A lot of times they'll say, "My favorite position is laying down flat on my back because that's the only position I can get in to find a little bit of relief." In my practice, when I want to confirm the diagnosis of SI joint dysfunction, it really relies on the physical exam. A lot of times imaging can be misleading, so you might not necessarily see a significant amount of degeneration or arthritis on an X-ray. Even sometimes an MRI might not be extremely diagnostic, but the physical exam is what's really going to point us in the direction of SI joint dysfunction. So there's certain tests that I will do, what we call provocative maneuvers, that can elicit pain at the SI joint. And if 3 out of 5 of these maneuvers are positive, it's a high probability that the SI joint is the cause of the patient's pain. After performing the provocative maneuvers in clinic, if we have a high suspicion that the patient has SI joint dysfunction, we send them for a diagnostic injection. That's the gold standard for diagnosing SI joint dysfunction. From a treatment standpoint, there's different ways to treat SI joint dysfunction. We always start in my practice with conservative measures. That might be therapy, certain medications, support bands. If that's unsuccessful, you can move on to a little bit more invasive treatments like injection therapy. For patients who fail conservative measures and want to proceed with surgical intervention, in my practice, I utilize the iFuse implant system. What really attracted me to the iFuse system was that it's a minimally invasive system. It's implanted through a very small incision. Usually it's an outpatient procedure and patients are up and walking the same day. The other thing that really attracted me to the iFuse implant system was the robust amount of data that supports it. In my practice, evidence-based medicine is the only way to practice, and so I'm always searching the literature to find out what are the best tools to use on my patients. I've been really pleased with my experience with the iFuse implant. The majority of my patients have done extremely well and are very happy with their outcomes and are back living the lives that they want to.
We have a big trip planned to Italy next year, which is going to be our 35th wedding anniversary, so I just can't wait. I mean, it's amazing to be able to do the things that we take for granted. I mean, seriously, stirring a pot, washing dishes, and you're in bed for a week? That's ridiculous. I am so excited to have my life back, and if it wasn't for iFuse and Dr. Barkoh, I just don't know where we would be today.
When I first met Gretchen, what really stood out to me was how frustrated she was. I mean, she'd been dealing with pain for years, but on top of dealing with pain, she'd been dealing with people not taking her seriously, being bounced around from doctor to doctor. My goal is to help patients find their path to a more pain-free lifestyle. And so if you or someone you know has been suffering with pain for days, months, years, and can't find a solution, I'd love the opportunity to work with you to try to find your path to a more pain-free lifestyle.